Welcome to Pinoy Medical Coder. Today, we'll discuss about how to become a Certified Professional Coder, or CPC, the gold standard certification in medical coding. Before we begin, please don't forget to like our Facebook page and like and subscribe to our YouTube channel. Launch your career with the CPC exam. The Certified Professional Coder exam is the conclusive step to attaining CPC certification, renowned throughout the world of healthcare as the gold standard for physician-based medical coding. By passing the CPC exam and earning the right to append the CPC acronym to your name, you become a healthcare business professional recognized for reliable mastery of professional fee medical coding. What is the CPC exam? The CPC exam is a test of medical coding proficiency consisting of 150 multiple-choice questions that assess 17 areas of knowledge. Most questions present a coding scenario to test proper application of CPT procedure codes, HCPCS Level 2 supply codes, and ICD-10-CM diagnosis codes, all of which medical providers use to submit claims to payers. During the test, you will reference approved coding books, the AMA's CPT Professional Edition, as well as your choice of ICD-10-CM and HCPCS Level 2 code manuals. You must complete the CPC exam within 5 hours and 40 minutes and answer 70% of the questions correctly to pass. Who should take the CPC exam? After you've trained with AAPC to become a medical coder, or if you have substantial medical coding experience, you should take the opportunity to gain certification by registering for the CPC test. Passing the CPC exam elevates your earning potential by greater than $20,000 above annual salaries for persons without AAPC's medical coding certification. And CPC salaries, averaging $54,401 in 2018. Maintain a 9% increase each year. What's more, the demand for certified medical coders continues to grow, with a 22% rise in jobs projected by 2022. How do I prepare for the CPC exam? Get ready for the CPC test by starting with the essentials. Education. The surest way to prepare for the CPC exam is to train with AAPC by enrolling in the CPC preparation course. This program, designed by the creators of the CPC exam, will ensure you receive an effective and comprehensive education covering proper use of all medical code sets you'll encounter on the exam. Supplementary courses. If your history hasn't reinforced knowledge of anatomy and physiology, as well as medical terminology, you'll want to study in these areas or enroll in the respective classes designed exclusively for healthcare business professionals. Practice exams. Those who have earned their CPC credential accredit their success to taking practice exams once they begin approaching the end of their studies. AAPC's practice exams will take your training from book knowledge to working knowledge, giving you assurance that you know the material, as well as confidence needed to perform optimally on your exam. Why do employers look for the CPC credential? Medical coding accuracy is key to optimal, ethical reimbursement, which makes medical coders integral to the financial resources of every healthcare organization providing treatment and services to patients. For more than 3 decades, CPCs have established an unwavering reputation of excellence. The title of Certified Professional Coder therefore comes with high expectations, trust, and respect. Passing the CPC exam unequivocally demonstrates to employers that you possess expertise in assigning accurate medical codes for diagnoses, procedures, and services performed by physicians and other qualified healthcare providers in the office, as well as professional fee coding as it pertains to facility settings, for example, inpatient hospital. Sound knowledge of coding guidelines and regulations to meet compliance requirements, such as establishing medical necessity, using modifiers appropriately, and observing bundling rules. proficiency across a wide range of services, including E&M, anesthesia, surgery, radiology, pathology, and medicine. Thorough grasp of anatomy, physiology, and medical terminology to comprehend clinical documentation and code descriptors. Understanding of how to integrate medical coding and payment policy changes into a practice's reimbursement processes. The CPC exam breakdown. Passing the CPC exam requires you to correctly answer a minimum of 105 questions from the series below. The exam questions, however, will not be identified or sorted by the series to which they pertain. The CPC test will rely on a level of understanding that enables you to identify the series. Includes 1. Integumentary system. 2. Musculoskeletal system. 3. Respiratory system. 4. Digestive system. 5. Urinary system. 6. Nervous system. 7. Anesthesia. 8. Radiology. 9. Laboratory and pathology. 10. Evaluation and management. 11. Medicine. 12. Medical terminology. 13. Anatomy. 14. ICD-10-CM diagnosis. 15. HCPCS Level 2. 16. Coding guidelines. 17. Compliance and regulatory. Certification requirements. We recommend having an associate's degree, not required. Pay examination fee at the time of application submission. Maintain current membership with the AAPC. New members must submit membership payment with examination application. Renewing members must have a current membership at the time of submission and when exam results are released. ICPC designation must have at least 2 years medical coding experience. If you have not submitted proof of 2 years on the job experience, a CPCA designation will be awarded. For more details, check the link here. Membership is required to be renewed annually and 36 continuing education units, CEUs, must be submitted every 2 years for verification and authentication of expertise. For CEU requirements, please see out CEU information page. Note: each examination is separate and distinct from one another. To obtain all certifications, each examination must be taken separately and passed. An overall score of 70% or higher is required to pass an exam. For examinees who do not pass, only the areas of study or categories with a score of 65% or less are provided for examinees' preparation. The areas of study reported reflect scores based on the number of questions in each category or section of the exam. Each of the category or section may vary in the number of questions asked. For more information, please check the following link at www.aapc.com/certification/CPC. Thank you for watching.